Hi, my name is Denis Gilmore, and I'm a thoracic surgeon at TriStar Centennial Medical Center.
Hi, my name is Ventola, and I'm an interventional pulmonologist at TriStar Centennial Medical Center.
November is Lung Cancer Awareness Month, and we just want to raise the awareness of what we're doing here at TriStar Centennial and Sarah Cannon Cancer Center in regards to early detection of lung cancers and the treatment options we have available, including minimally invasive surgical resection, as well as chemotherapy and radiation options for all patients with lung cancer.
Early detection of lung cancer is especially important. Unlike other types of cancers, usually symptoms don't arise until you're later in the stages, and that way you have less options as far as treatment is concerned. That's why screening is so important. If you're between the ages of 55 and 74 and you've been smoking within the last 15 years, you would qualify for lung cancer screening. With the lung cancer screening, we often find nodules. These nodules we're able to biopsy and diagnose lung cancer early using special techniques, including navigational bronchoscopy. With those new techniques, we're now able to find smaller nodules and biopsy them farther out in the periphery of the lung. What we're able to do is find the nodule and then use a robotic bronchoscope to drive down to the area where it's located, confirm that the nodule is there, and then place instruments in to get a diagnosis and get you closer to treatment.
Here at TriStar Centennial, we have a multidisciplinary approach to treat patients with lung cancer. We have pulmonologists, interventional pulmonologists, and thoracic surgeons here at TriStar Centennial in conjunction with medical oncologists and radiation oncologists at Sarah Cannon Cancer Institute to help treat patients with lung cancer. We're able to identify nodules at an earlier stage, obtain a diagnosis at this early stage, and treat patients with minimally invasive robotic lung resections. We have state-of-the-art treatment with radiation oncology at Sarah Cannon, as well as clinical trials using chemotherapy and immunotherapy for patients with lung cancer.
Oftentimes, these pulmonary nodules are found incidentally on scans that aren't even looking for them. That's why it's important, if you ever see in a report that you have a lung nodule, to bring it to the attention of your doctor and be an advocate for your own health. Screening is immensely important. Early diagnosis and treatment is exactly where we need to be moving forward. We're getting better and better at decreasing the mortality of lung cancer and making sure our patients are home with their families. Thank you for listening. For more information, please go to tristarcentennial.com.